Hi everyone and welcome back to another video. Today we're going to talk about extended release oral minoxidil, what it is, how it works, and what you can expect from it. So first of all, why do we even need a new version of minoxidil? What are the problems with the existing formulations of minoxidil? So when it comes to topical minoxidil, which we know oftentimes come in concentrations of 2%, 5%, 10%, or occasionally even 15%. We know from looking at various different clinical trials that there is, generally speaking, a low adherence, and people typically quit their topical minoxidil regimen after a few months. And patients claim things like it's greasy or it causes scalp irritation, which, to be fair, scalp irritation is oftentimes a side effect of some of the carrier agents like propylene glycol instead of minoxidil itself. And some people claim that there is a lack of results. And this might be, at least in part, because minoxidil is a prodrug and it has to be converted into minoxidil sulfate by sulfation via the sulfotransferase enzyme in order for it to produce and exert its hair growth effects. And we can see from here that scalp sulfotransferase activity was higher in men who responded to minoxidil compared to those who did not respond. And so some people with low scalp sulfotransferase activity might not see great results and quit their topical regimen. When it comes to oral minoxidil, we know that oral minoxidil was never originally developed for hair loss. It was actually a drug developed for hypertension or high blood pressure. And so if you're taking oral minoxidil for hair loss, the most obvious side effect is that you might experience a lower blood pressure, and you might also have some related cardiac side effects like tachycardia or irregular or elevated heart rates. There can also be inconsistent outcomes, and instant release minoxidil leads to a spike in blood plasma levels. So what do we mean by this? So the existing oral minoxidil formulation available on the market is instant release. This means that it dumps the whole minoxidil payload into your system pretty much right away. And so we can see from this graph that the moment you take minoxidil, it causes a spike in minoxidil concentration in your bloodstream as measured by nanograms per milliliter, and then it quickly crashes back down below the therapeutic window for hair growth. And we can see the same in this other graph over here. You take minoxidil, it quickly causes a spike in minoxidil in your system, and then it quickly crashes back down. And so here we have a quote from the Veradermics website. Veradermics is the pharmaceutical company currently developing the extended release oral minoxidil. And they say that with immediate release oral minoxidil, the drug levels spike right after it's taken, and majority of the drug leaves the body after approximately 2 hours, limiting the time available to stimulate regrowth, and has been shown to be associated with cardiac toxicities. And so here we can see the curve for instant release minoxidil over time in red. And we can see that, if we consider this dotted line to be the threshold for hair growth, we can see that it quickly drops down below this threshold. And if we consider this other dotted line up here to be the threshold for various cardiac side effects, it actually goes beyond this line, causing cardiac side effects in some people, and also dropping down below this hair regrowth threshold, limiting hair growth benefits. On the other hand, the blue line shows the concentration of minoxidil in your system when you take extended release oral minoxidil. And so with an extended oral minoxidil tablet, the minoxidil is slowly released into your system, creating this much more stable concentration of minoxidil in your system. And the idea is that this will lead to more hair growth and have fewer side effects. So what actually is extended release oral minoxidil, and how does it work? So VDPHL01, which is the extended release oral minoxidil compound currently being developed. We know that VD stands for Veradermics, which is the pharmaceutical company developing this. PHL, pattern hair loss, and 01 is likely to just be the version or compound identifier. And we know that at 8.5 milligrams in men and 4.5 milligrams in females is an investigational oral drug to treat male and female pattern baldness. And the extended release mechanism is actually not a novel idea. This is something that is commonplace in pharmaceutical compounds. It's just that this is the first time that the extended release mechanism is being applied to oral minoxidil. So oral minoxidil currently available in the market is all instant release. And so Veradermics have come up with this custom-made extended release mechanism specifically for minoxidil for hair growth. So this is the first oral minoxidil for hair growth. And the way it works is the minoxidil particles are mixed in with the slowly dissolving matrix, which then allows minoxidil to slowly and gradually be released into the system over a greater time window. And so provide a longer duration of therapeutic levels of hair growth compared to the current immediate release minoxidil. And so we can see here that instant release oral minoxidil causes this crash. It goes above the cardiac side effect threshold and potentially does not spend very long above the therapeutic window for hair growth. On the other hand, extended release oral minoxidil can spend more time above the therapeutic window for hair growth, and therefore the idea is that it will improve hair growth results compared to the current instant release mechanism and also minimize side effects. And we can see from this article that by smoothing the pharmacokinetic curve, the extended release formulation aims to maximize efficacy while minimizing cardiovascular risk. There is a tenfold difference between the concentration required to trigger hair growth and the level associated with adverse cardiac effects. So, is there any data to actually validate the efficacy of extended release oral minoxidil? So here we have a retrospective phase 2 trial that compares the efficacy of VDPHL01, which was taken at 8.5 milligrams twice daily for a total exposure of 17 milligrams per day in 20 patients over a 4-month period. The other treatment groups included instant release oral minoxidil 5 milligrams once per day in 33 patients over 6 months, and topical minoxidil at a 5% concentration solution in 34 patients over 6 months. And so the results of these treatment groups were compared using a blinded investigator global assessment. And what this means is that dermatologists were given the before and after images associated with these 3 treatment groups without actually knowing which treatment group the before and after pictures belonged to. They also didn't know which was the before and which was the after. And so the dermatologist had to basically look at the images and determine which was the before and which was the after. And we know that with the extended release oral minoxidil formulation, the cosmetically perceptible effects were so obvious that there was a 97% success rate in identifying the before and after pictures correctly. In terms of the instant release oral minoxidil, these percentages dropped down to around 72%. And with the topical minoxidil formulation, this was 60% in the frontal area and basically guesswork in the vertex area. And then these before and after pictures were given a ranking from -3 all the way to +3 in terms of efficacy. And we can see that in the VDPHL01 group, the mean score was just over 2 in both the frontal and vertex areas. This was just over 0.5 in the instant release oral minoxidil and 0.29 and 0.02 in the frontal and vertex areas of topical minoxidil. Now, this retrospective study does give some indication that the extended release form of minoxidil demonstrates superior efficacy in a shorter duration. That being said, this is not a perfect study. For starters, the before and after pictures are not made publicly available, so we can't see this for ourselves. We have no hair count data, we have no hair diameter data, so we have very limited data to work with at the minute. We also know that there is a conflict of interest. The company that commissioned this study is Veradermics, the very same company that is currently developing the extended release oral minoxidil formulation. And it is a retrospective study, right? So it's not an apples to apples comparison. We're comparing 8.5 milligrams twice a day against 5 milligrams once a day, 4 months and 6 months. So we're not just isolating the one variable that we're interested in, which is extended release versus instant release. And that being said, extended release oral minoxidil does seem very promising, and more data to come before this new product comes to market, and it's not yet available to purchase. So it does seem like a really good upgrade to the oral version of minoxidil, specifically in terms of addressing hair loss or pattern hair loss, but it's not available yet. So in the meantime, if you do want to use minoxidil, you can use the topical version with enhancers like microneedling and or tretinoin. Obviously, you can use the oral one as well if that works for you. And obviously, there are many other ways of actually addressing pattern hair loss. And if you'd like to learn more about that, you can read this free ebook in the description below.